All right. Welcome, everyone. Welcome to Dialogue with ADA. I am Dr. Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association. And I am so pleased to have Dr. Jillian with me. And we are talking about the kidney because it is National Kidney Awareness Month. And so I'm going to let Dr. Jillian introduce himself, and then we're going to get to your questions, put them in the chat, and we look forward to a great discussion.
Well, thanks, Dr. Gabay. I appreciate it. I really appreciate being here. March is National Kidney Month, although in my world, I think every month is Kidney Month. And really, it is an opportunity for us to teach people about kidney health, especially people that have underlying diabetes, because unfortunately, diabetes and kidney dysfunction can go hand in hand, if you will. And so we want to make sure that people understand how the kidneys work, how to keep them healthy, and how hopefully you never have to see a doctor like me.
Well, you have a wonderful personality, so people would want to see you. But tell us a little bit. So, why is the kidney so important? Let's level set. What does it do?
Yeah. Well, we're born with two kidneys in most cases, and fortunately, we really only need one kidney to be healthy. The kidneys function as very, very sophisticated filters. In essence, everything that we do every day, when we eat and when we move and when we think and when our heart beats, all of that physiologic work leads to the release of poisons and toxins, waste products, if you will. And those waste products end up in the bloodstream, and then the kidney filters them out. And the job of the kidney is really to do two things: get rid of all of the bad stuff and keep in all of the good stuff. So the kidneys get rid of two things. They get rid of poisons and they get rid of extra water. Obviously, we drink water and tea and coffee and everything else throughout the day. And if we didn't have a mechanism for getting rid of that extra water, we would blow up and look like the Michelin Man. And of course, if we didn't have a way to get rid of all those poisons and toxins, they would build up in our system, and that wouldn't be good either. So the kidneys are just very sophisticated filters, and they keep our bloodstream clean.
Yeah, so toxins and water. So, when the kidney's not working, how would people know it?
Well, this is tricky because we're born with, let's call it 100% kidney function. If we've got two working kidneys and we're young and we're healthy, then we're at 100%. And over time, because of just wear and tear from age, but also because of things like high blood pressure and diabetes, unfortunately, those filters in the kidney, they get scarred and they get damaged. And so then we go from 100% kidney function to 90% to 80%, et cetera. And the truth of the matter is we don't feel that. Our body is really, really good at compensating for that lower amount of kidney function. When you get somewhere around 20% of kidney function, so a person has lost about 80%, then you start to have some symptoms. And sometimes those symptoms are very nondescript. They can just be like, not having as much energy, a little more fatigue. Sometimes people complain of a little bit of a funny taste in their mouth. And then as their kidney function gets worse, down around 15% and 10%, that's when you can really start to have real significant issues, heart issues, and pretty significant symptoms as well. And we want to make sure we're treating patients long before they ever get to those high levels of kidney dysfunction.
Yeah, so it really is this story where you can go on and on and on and be losing literally 80% of your kidney function and not even know it. So, what how do we prevent that?
Well, we prevent it the way we prevent lots of things. We prevent it with great diet and following our physician's advice when it comes to taking medication. So I mentioned that two of the top reasons that people have kidney dysfunction is because of diabetes and high blood pressure. And so clearly there are things that we can do to keep our diabetes under control: diet, exercise, taking the right medications, either by mouth or, if needed, insulin. For high blood pressure, we want to do the same thing: diet, exercise, getting enough sleep, treating sleep apnea if somebody has it, avoiding sodium in our foods. And remember, sodium is often hidden in things because it's not only something that makes our food taste good, but it's a preservative as well. And so if we can work with our patients upstream, meaning before they're down around 20% kidney function, we can really help keep those kidneys healthy. And it comes down to those things that I just mentioned: lifestyle, diet, and doing a really good job of taking our medications.
Absolutely. Those are all really important. And One of the things that certainly I've seen, and I'm sure you have as well, is um, because there are no symptoms, people don't realize they have significant kidney damage. And the good news is that it's pretty easy to make the diagnosis. It's not tricky.
It's not tricky, you're right. And so this is where we want our patients to really take an active and engaged role in their own health and have conversations with their primary care physicians. Obviously, primary care physicians are on the lookout for this, but we want to know and we want to start treating patients long before their blood tests show up. So there's two ways we know that patients can have some kidney damage. One is looking at their blood and looking at a laboratory test called creatinine. The other one is actually to look at their urine and evaluate for extra protein. I mentioned that the kidney's job is to get rid of extra water and extra protein. Extra water and extra poisons. But the other job of the kidney is to keep good stuff in. And protein is a good stuff. It's a good thing. And so protein should not be leaking out through those filters. If it is, it means there's some holes or some damage in those filters. And so by having those conversations with our primary care doctors, talking to them about, hey, what do my blood tests show about my kidneys and what do my urine tests show about my kidneys? That's how we can really catch kidney issues early on, where we can intervene and really change the course of care for a patient.
Absolutely. And I can tell you, I'm always open to patients saying, "Hey doc, like, have you checked my kidney recently?" We can all be reminded. We have lots to keep track of, and so you're absolutely right. All of you can check with your provider and make sure that you've had your kidney checked, and simple blood test and urine test. And I guess the other piece of this is we know that people have not been seeing their providers as usual because of the pandemic we're in. I don't know from where you're sitting, you've seen any data on that.
Yeah, we have absolutely seen that fewer and fewer patients over the last year have gone in to see their primary care doctor or seen their kidney doctor if they're already under the care of such. Now, some of that has been made up by telehealth, and telehealth is great. It's convenient for patients, and I like that, but it doesn't substitute from an actual good evaluation, face-to-face discussion with physicians. So I'm hoping, I don't have wood next to me, but I would knock on wood if I could. I'm hoping that as we all get more access to vaccines, that getting back and seeing our primary care physicians, seeing our endocrinologists, and seeing our kidney docs is going to take priority once again.
Yes, and getting those lab tests, which has really been faltering because people understandably have been physically distancing themselves. Well, before we go too much further, and we're getting some questions, let's just make sure people understand. So this is Dialogue with ADA, the American Diabetes Association. Why are we talking about the kidney?
Well, I think we're talking about the kidney because, as I mentioned, they go hand in hand. 40% of all kidney patients have diabetes, and quite frankly, many people, in fact, I would say a large percentage of people that have diabetes have some amount of dysfunction with their kidney. So these are two specialties or two medical illnesses that truly cannot be separated. We've got to think of them in terms of how they interact with one another.
Yeah, absolutely. And the number one cause for kidney failure is diabetes. So it's obviously something we need to talk about. So we've gotten some questions. Let me sort of throw that out. So there's some questions about diets, and some people one person asks, why do some doctors say that low carb diets can be bad for the kidney? Is that something we need to be concerned about?
Yeah, this is always a tricky area because
Yeah.
if you start talking about, a diet that's good for your heart and a diet that's good for your diabetes and then a diet that's good for your kidneys and your blood pressure and everything else, I joke that the only thing left to eat feels like it could be just cardboard. Of course, that's not quite true, but that's often the way it feels to our patients, that there's nothing left. Here's what I would say. The best diet for weight loss, for blood pressure control, for diabetes is a good, healthy diet with fruits and vegetables. There's just no substitute for fruits and vegetables and getting away from processed things that have a big shelf life. They have lots of sodium in them. They have hidden sugars in them, etc. There was a study, gosh, now it's been about 2 decades, that showed that really, really high protein diets, so some of these fad diets that where you only eat like steak and eggs, those can be pretty tough on the kidneys. The kidney has to process all of that. And so I would say that increasing our protein, decreasing carbohydrates, especially added sugars, is a good thing. But we never want to go overboard, right? We can always take something that's too good or something that's good and make it too good, I guess, if you will. And so I would say everything in moderation. And quite frankly, if you're on a diet that is really good for your heart health and your diabetes health, then that's probably the right thing for your kidneys as well.
Yes. And for folks that are interested, the American Diabetes Association website, diabetes.org, has lots of information about diet that is healthy for people with diabetes and also people with diabetes and potential kidney disease. And I'll plug one other thing that people may not know about. Often we're trying to figure out what to cook and what to make at home. And we have a food hub that has many recipes and lots of ideas of what you can do. So let me get to the next question. Um, um, is there a scorecard, or are there some questions that you think people should be asking their primary care provider to make sure they're doing well and protecting their kidneys?
Yeah, we often remind people to know your numbers. And quite frankly, that's a terminology that's used in diabetes care as well. But when we talk about it in kidney care, the types of numbers we care about are: one, what is your hemoglobin A1C? How is your diabetes being well taken care of? The second number is, what is your creatinine? Creatinine is a blood test. It's actually made, creatinine as a molecule is made by our muscles all the time. So I make creatinine, you make creatinine, and we make it. It gets filtered, we pee it out. And so if our kidneys are working well, that creatinine number stays very low, because in essence, as quickly as we make it, we get rid of it. If the kidneys are not functioning as well, your body keeps making it and that level rises. So we want people to know their creatinine. And then the third one is, know if you have protein in your urine or not. And so that's not quite the same as knowing a number, although if you get more sophisticated, you can tell what level that is. But it's enough to just say, do I have protein, extra protein in my urine? Do I not have extra protein in my urine? If the answer is yes, then it's probably time to see a kidney specialist.
Well, that brings up a great question. Yeah. So, someone goes and they ask their doctor, and they are told, well, yeah, you've got somewhat reduced kidney function. You have some kidney disease. So, what do they do next?
It really depends on how reduced their kidney function is, what their age is, how quickly that kidney function is going down, and what other illnesses they have. So as an example, I mentioned that we were born with 100% kidney function. It can go down to 90%, 80%, 70%. And some of that just happens with wear and tear. Quite frankly, just like our bodies get old, our kidneys get old as well. And so if somebody is, let's just say, advanced age, maybe they're living in their 80s, and they're at 60 or 70% kidney function and they're otherwise healthy, they do not need to see a kidney specialist, because quite frankly, that level of kidney function is probably close to normal for them. But contrast that with somebody who's 25 or 30 years old. If they're already down to 80% kidney function, we ought to be encouraging them to see a kidney specialist. Where the cutoff is a little different for everyone, but I'll just give sort of a vague number. And that is, if you get down below about 60% kidney function, and certainly as you get down below 50%, I think it's pretty important to start checking in with a kidney doctor. That doctor might only need to see you one time a year, check a few things, make sure that your medications are right, making sure that your blood pressure is under control, and then just check you again in a year. But on the other hand, if they find out that that kidney function is going downhill or decreasing function at a rate that is higher than expected or faster than expected, then that kidney doctor is going to want to see you pretty regularly.
Yes. So it's a bit knowing where you are for your age, number one. And if you're worse than your age should be, yeah, it's probably time to be thinking about seeing a kidney doctor. And the other thing that I've seen that is really helpful, kidney doctors do, is identify why. Because there can be reasons. Diabetes, of course, is a leading cause, but there could be other causes that need to be addressed. And again, you wouldn't know it. And this is one of the services that nephrologists or kidney doctors can provide.
Absolutely. I think every nephrologist I know has been fooled more than once on a case where we think it's due to diabetes or high blood pressure. And when we get in and do some other blood tests and maybe even take what we call a kidney biopsy, a tiny, tiny little sliver of that kidney to look at under the microscope, we find that actually there's something else going on, maybe in addition to diabetes, that needs specific treatment. There have been other times when, quite frankly, I've been wholeheartedly convinced that there must be something else going on. And when we look into it, it's just the diabetes. And so this is why a full evaluation by a kidney doctor can be helpful, because we want to make sure that we're individualizing care, finding the right treatment for each person so that we can help them thrive and live a long, healthy life without having kidney failure.
Absolutely. And the challenge, as you know, is that many people don't get referred to kidney doctors until they're really far advanced, at which point there's much less you can do. Um, there could have been things to have been done much earlier. And so that's why it's really important to encourage. That's another question to ask your doctor. If your kidney function is not normal, how bad is it? And should I see a kidney doctor?
Yeah, absolutely. One of the things that I think is most frustrating for me as a physician, and probably frustrating for patients as well, is when they don't come to see us until really they're on the cusp of needing a kidney transplant or unfortunately needing to start dialysis. And obviously, if we get to that point, there's not a whole lot that we can do to change the course of events. And so we want to make sure that we're seeing patients early, identifying what we can do to help them, and really changing the course of their kidney function such that it lasts a much longer amount of time.
Yes, I agree. And so you mentioned high blood pressure as another factor here, and of course, people with diabetes often have high blood pressure, and high blood pressure, I think, is the number two cause for kidney disease.
Yeah, high blood pressure. I used to sort of say that people can get three strikes, unfortunately. So diabetes is the number one cause. High blood pressure is the number two cause. And then there are certain genetic backgrounds. And unfortunately, in this country, people who are either indigenous or of African American or African descent, Black individuals, tend to be at higher risk for kidney function, kidney dysfunction. And so, unfortunately, we have some people in this country that fall into each of those categories. They have diabetes, they are Black, Hispanic, or Native American, and they have high blood pressure. And I used to say, gosh, that's like having three strikes. And I don't mean it to sound derogatory in any way, because we can still intervene, we can still do things. But if there is that combination, we need to make sure that we're intervening pretty aggressively, because that is an absolute recipe for declining kidney function and needing to get a kidney transplant or go on to dialysis.
Yes, and the good news is if you have some of those strikes or some of those risk factors, there's much that can be done to prevent the kidney from getting to that later stage of dialysis or transplant. A couple of other questions. Um, so, you know, uh, uh, with uh, with the pandemic and people unable or concerned about seeing their providers, where does the role of the kidney doctor perhaps in rural areas fit in, and what are, I don't know, are there other ways to sort of get the care that you need?
Well, this is where I think telehealth gets really exciting, and I don't think that telehealth saves everything and fixes everything, but I think it's one more way that we as physicians can help improve access to care. So, especially if you're a high-risk individual, what I just mentioned, if you've got a background or a family history of kidney issues, if you've got diabetes that's not in control and high blood pressure that's not in control, then we want to make sure that you're having these conversations with your primary care physician so that it is top of mind for them. They've got a lot of things to think about: breast cancer screening and prostate cancer screening and any number of other things with regard to your cholesterol. And we want to also make sure that your kidney health is at the top of their priority list. And so having these conversations is really important. And I know, living out where I do, I'm in Denver, so we've got plenty of kidney doctors. But if we just go further north to Wyoming and into Montana, it gets a little bit more scarce. And so this is where I think telehealth comes in, and being able to have some of these interactions with specialists over a telephone or over your iPhone or something like that. We can get labs done on just about anybody anywhere in the country. And if we as physicians can see those labs, can take a look at you, can hear about your history, understand your family history and other of your health dynamics, we can often come up with a treatment plan that will help keep your kidneys healthy.
Yeah, I think that has been, not that there is any silver lining to what we've been through in the last year, but the explosion of telehealth and those options, and particularly for people that have less access. The other thing I wanted to highlight, when you talked about racial and ethnic groups that are at higher risk for kidney disease, that is an area that the American Diabetes Association has really been focusing on a great deal through our Health Equity Now. And I encourage people to go to our website, and you can capture a lot of information. I know that's something that you're concerned with as well. And so how do we raise awareness on this more effectively? Because clearly there's a need.
There is a need, and unfortunately, kidney disease, as it's called, is not a fair disease. It hits some of us to a greater extent than it hits others, and health equity clearly requires that we get the word out so that every single person has knowledge about this. And this is why I'm so excited about partnering with the American Diabetes Association, so that we can get the word out. We do this with other professional organizations as well, the American Society of Nephrology, the National Kidney Foundation, because a group of people who understand that, hey, my kidneys might be at risk, that's a group of people that we can help intervene with. And so getting the word out is absolutely crucial.
Yeah, I could not agree more. And that really, so much of this, like a lot of things in diabetes, people don't have symptoms until things get really far advanced. And so it's really about getting tested early. And the test is simple. Literally every laboratory, I can't imagine a laboratory in the US that would not be able to test your kidney function. So it's not a complicated test. It's easy and widely available. Let's just talk a little bit. So down the line, unfortunately, people, their kidneys do fail. And so what are the options at that point?
When the kidneys fail, there are three options in essence. There is what we call renal replacement therapy. Renal means kidneys, so it's oftentimes called kidney replacement therapy, and that can be done a couple of different ways. It can be done through a kidney transplant, which I mentioned. That is always the best way to improve kidney health, is to get a transplant either from a loved one or to wait on a waiting list and get a kidney when one becomes available. If you're on a waiting list and you haven't yet been able to get a kidney transplant, then we do something called dialysis. There are a number of different ways of doing that, but the term dialysis means to clean your blood if the kidneys can't clean it. And so we can do dialysis where somebody comes into a dialysis center and gets the help that they need to clean their blood multiple times a week. That is a form of life support in essence. Or we can actually train people to do dialysis on their own at home. It sounds very scary, but quite frankly, it's a relatively straightforward treatment. And so those are the treatment options. Of course, some people, because they've got multiple medical issues or maybe are older, choose not to do dialysis and not to get a kidney transplant. And at that point, then it's the important role of the physician to help have some of those end of life conversations that none of us want to think about, but they are so important. It is ultimately something that for millennia, physicians have helped patients with.
Yep. And I guess the good news that we take out of all this is it's easy to diagnose. One of the questions was, how often should I get screened if I have diabetes? At least once a year. Everybody should be screened. And if you screen people early and you identify the issue, you can prevent all of these bad things from happening, controlling your blood sugar, controlling your blood pressure, eating the right foods, getting exercise. It looks like we're out of time. I really appreciate all of our audience here thinking about kidney health in the midst of Kidney Awareness Month. And I very much thank Dr. Jillian for joining us today on Dialogue with ADA.
Thanks, Dr. Gabe. Appreciate it.